so my name is Jasmine. I am going to be demonstrating how to do a baby bath and some other parenting that you will do for the baby, the newborn baby. So first, for the baby bath, you are going to make sure you wash your hands and put gloves on for the first time that you do bathe your baby. You want to make sure the room is 75 degrees, so the room is warm, and you also want to test the water to make sure the water is warm but not too hot and not too cold. The baby is a newborn, so it has thermoregulation problems. You are going to want to fill the baby tub with water, warm the water, and you're going to only want to put it up to the halfway mark because the baby should not be submerged into the water. And then when the water is done, you want to push the knob away from the sink. So you have your baby, you want to make sure you have all of your things, your supplies gathered around and ready before you do the baby bath. So you have the baby onto the towel. If you do need to turn away for any reason to grab anything, you want to make sure you always have your hand on the baby, turn away and grab what you need, and then come back. Okay, so you're going to wrap the baby into the towel that it will be in the baby tub. Right now I'm only using a little bowl, I didn't have a baby bath. Alright, so you're going to put the baby into the baby bath. And you never ever want to put soap into the water. So the first thing that you're going to do is you want to make sure that you cover the baby's legs while you're doing the top, and then when you're doing the top, and when you're doing the legs, you want to cover the top. So here, you cover the legs. Okay, so then you're going to dip the washcloth into the water, and then you're going to want to wash the baby's eyes. You want to do in and out, so you don't get any contamination into either eye. So you're going to do in and out, and then you're going to use a different spot on the rag. In and out. You're going to wash the baby's face with the water. Put the rag down. And then you're going to get your baby soap and you're going to put it on your hands. And then you're going to lather the baby up. And then you're going to dip your washcloth back into the water. And you're just going to rinse them off. And you want to make sure you get into all of the folds beneath the armpits and all of the baby folds. Okay, rinse them off, and then you're going to move down to the legs. So you're going to cover the top portion, open the legs, cover the top, keep the baby warm. And you're going to do the same thing. Take your baby soap, rub the legs, take your wash rag, dip it into the water, and rinse. All right, so that is done. You want to make sure you have your dry towel to put the baby in whenever you are finished doing that. You're going to lift the baby out, put it on the towel, kind of swallow them a little, get them dry. Alright, you're going to wrap them up. And then you're going to do the football hold, and we're going to do washing the hair. This is the football hold that you are going to use to wash their hair. So you want to make sure you get your baby soap. You're going to lather the head again. And then you're going to dip into the water and just wash the hair. Okay. So the next thing that we can talk about is the diaper and peri-care. Peri-care on a newborn baby girl, you're going to want to wipe them from front to back because you don't want to get any contamination into the urethra or the vagina. And then you don't want to get any feces. You're not supposed to be, so you're going to do front to back for a baby girl. For a uncircumcised baby boy, you are going to wash the penis, of course, but you don't want to pull back the folds because it can get stuck and cause some issues, so you don't want to do that. And then for a circumcised baby boy, you're just going to wash the penis as normal, and then you're going to want to put some Vaseline on the tip, also the 2x2, on top of the tip when you put the diaper on, so that way the penis doesn't stick to the diaper. If you see any drop of blood, like a little drop of blood, then that's completely normal. Also, for the female baby girl, it is normal for her to have a little bit of blood or a white discharge, and that is from the withdrawal from the hormones from being in the placenta. Also, when you do the diaper as well, when you put the diaper on, you want to make sure you do not cover the umbilical cord because it needs to be dry and get air at all times, and it should fall off between 7 to 10 days. So for the diaper, you want to make sure the folds, whenever you put the diaper on, the folds should be in the front. They should fold in the front. So we're just going to get this out. This open. Okay. So you're going to lift their legs. And this baby doll is a little small, like really small, so this diaper is going to be really big. Great. So make sure you get that between your legs, and then you get the folds to the front. And you kind of want the folds to be as close together as they can. Of course, in this scenario, it's going to be, overlapping because the diaper's really big. So you also want to make sure you get a good sized diaper for the size of your baby. And then you want to make sure you just fold the diaper down so it does not cover the umbilical cord. When the baby does pee, this yellow line that you see here will turn blue. And the baby should have at least 6 to 8 wet diapers in a 24-hour period. Some things to talk about as far as SIDS, which is sudden infant death syndrome. For sleeping needs, the baby should be in the crib or their bassinet or whatever they're in, and they should have nothing in it, no blankets, no toys, no nothing. They need to be flat on their back, never on their stomach. They should also be in the room with the parents, but they should not be in the bed with the parents, and that should be up until 6 months to a year. There should be no illicit drug use, any smoking or alcohol around the baby, because that can cause away further the attention to be deferred from the baby and their responsibilities of the child. What else? For SIDS. That's pretty much the big thing. For tummy time, for them being on their stomach, the only time they should be on their stomach is during tummy time, and that should be when the baby is awake, the mother is awake, or the parent is awake, and you are completely focused onto the baby. Some different type of holds that you can do for the baby is the upright, which is over the shoulder, which is good for burping. You have the cradle, and then you have the football hold, which is mainly for watching babies here. The next thing is the halo swaddle. That is to swaddle the baby to keep them warm. So the baby's arms will go into little pockets into the swaddle, and then you just do left to right when you swaddle the baby, wrap them up, and then it'll Velcro in the front.